This is the beginning of Women's Health and Maternal Newborn Nursing Lecture.
All right, before we even get into this whole thing, we've got to discuss some stuff about us women. All of us go through a cycle every month, unless we've hit menopause. But by and large, we all go through a cycle every month. And all the guys will tell you, yes, they know that we go through a cycle every month. During the ovulatory cycle, which is the beginning of your cycle, follicular-stimulating hormone and luteinizing hormone is released from your anterior pituitary. Now, these are tropic hormones. What is a tropic hormone? A tropic hormone is something that stimulates another gland to produce the target, a target gland to produce the target hormone. So FSH and LH stimulate the ovaries, and stimulate the follicles in the ovaries and the corpus luteum to produce estrogen. So FSH and LH are released in the ovulatory cycle from the anterior pituitary. The mature egg, the ovary, then releases estrogen and progesterone, does both. More estrogen than progesterone, that's true, but does produce both, to prepare the endometrium. Now, what's the endometrium? That's the lining of your uterus, right? To prepare the endometrium just in case you get pregnant. Believe it or not, folks, that's all our uterus, that's all they do. Every month, that's all they do, is just prepare for possible pregnancy. Remember that it's in the mid-cycle that this egg ruptures actually breaks off from the ovary. So remember, your cycle begins when? The first day of menstruation, right? So if you have a 28-day cycle, it's on your 14th day that this egg will rupture from the ovary. Now, once the egg releases from the ovary collapses, and this collapsed follicle becomes the corpus luteum. This corpus luteum also releases estrogen and progesterone. Now, this egg that is free starts to travel down the fallopian tubes. Can you all visualize that? Okay, as long as you can visualize that, we're doing really good. When you are assessing a woman, or when you're assessing a couple in terms of their fertility or in terms of their reproductive system, you've got to get a complete health history. And what does that mean? Well, you want the menstrual history. In other words, what was the date of menarche? When did they get their first period? You need to know that. Right now, believe it or not, a lot of kids are reaching menarche at the age of 9. There's a 10-year-old that I know who's pregnant. Yeah, we want to find the guy who did this. Yep, we sure do. We had an 11-year-old come in, and she was pregnant by a 28-year-old man. Mother was fit to be tied, ready to kill him. Well, we brought charges against him, and he said, because it was rape. This is statutory rape. And you know what he said? She didn't say no. Hello? Is there something wrong with this picture here? Okay, another thing you want to know is when did she have her last pap smear? So basically what you're doing is you want to find out if she's following up, if she's complying. Remember yesterday we talked about that? Every 3 years until the age of 40, and then every year after that. So you want to know if she's complying with the recommendations for pap smears. You want to find out her sexual history. Now this is very important. Okay, yes, maybe she reached the age of menarche. She reached menarche at the age of 12, but when did she have her first sexual experience? Okay, not only when did she have her first sexual experience, but what's her sexual activity now? What is her sexual activity now? Does she have a boyfriend? Does she have several boyfriends? Okay, and you've got to get their concept of what monogamy means. Monogamy to all of us means one boyfriend or one husband, right? To some people it means one at a time. Yeah. I had a patient come in and she had the PID shuffle. Y'all know what the PID shuffle is? You can't walk. You're doing one of these numbers because you have such severe pelvic pain because she had pelvic inflammatory disease. She had gonorrhea, she had chlamydia, and it had traveled all the way up and trichomoniasis also. It traveled all the way up to her fallopians. Okay, so she really had severe. She couldn't walk. This is what we call a PID shuffle. We can tell as ER nurses. Person walks in the door, we go PID because it's the way they walk. Okay. So anyway, she came in. She had PID. She was 17 years old. All right. Now, when I asked her, do you have a boyfriend? She said yes. And I said, well, the bottom line is she'd had this boyfriend for 2 weeks. Okay. Prior to this boyfriend, but she considered herself monogamous. Okay. Prior to this boyfriend, she'd had a boyfriend for 3 days. And then prior to that one, she'd had one for a really long-term relationship, 2 months. So, but to her, she was monogamous because she was having one boyfriend at a time. Okay. She said, I don't sleep with any more than one at a time. So she was monogamous. Didn't really understand. So, it's your job as a nurse to really explain this, what monogamous means. So you've got to find out their sexual history. Okay. Why do you want to find out their sexual history? Because you want to know if they're at risk for anything. I mean, this 17-year-old who had all these boyfriends did not feel that she needed to practice any kind of safe sex because she was only having one boyfriend at a time. And what do we teach people in AIDS education? Safe sex. And if you're monogamous, it's okay. Okay? But we have to explain a little bit further. Okay. Contraceptive history. What kind of contraception are they using? Are they using condoms? Are they using a diaphragm? Are they using birth control pills, spermicidals? What are they using? Are they using the plug, that cervical plug? What are they using? The patch? Okay, are they using pregnancy as a form of contraception? Some people do that. You get pregnant, you can't get pregnant for 9 months, right? So they use pregnancy as a form of contraception. The obstetrics history. Okay, how many kids have you had? How many pregnancies have you had? How many? 29-year-old woman that I took care of. She was on her 9th baby. Yep, pretty active lady. She was on her 9th baby. The 9th baby, it was very funny. She was a young black lady, and she was from Belgrade in Florida. She was black. I got to tell you, though, the nicest person you ever want to meet. The nicest person, funny as the day is long. She was brought into the hospital. She came in early because she had preterm labor. So she ended up making friends with all the nurses. Preterm labor. And she came in when she was like 5 months because she was contracting and she was dilated. So we put her on bed rest. And we're trying to put her also on a special diet. She would not eat the hospital food. She stayed in the hospital for about 2 months, and then she delivered when she was a little over 7 months. Okay, nice baby. She would not eat the hospital food, so she had all her friends from Belgrade bring her this fried chicken and the pizza and all this kind of stuff. She would eat a whole pizza, one whole entire giant supreme pizza, okay, at night. She could do it. My gosh, I tell you, I'd really admire that woman, because I can eat, but I cannot eat that whole pizza. So she would eat the whole pizza. Anyway, we become really good friends with her, and this was the 9th baby. She had 8 live births at home, 8. Live births at home. And she really wanted to keep this baby. Of all the babies, she really wanted to keep this baby. And then after that, she was going to get her tubes tied. So, one thing after another, we asked, why is this baby so important to you? We just kind of talked about it. And we said, geez, you got 8 at home. How come this one is so much more important? She says, because the father of this baby is a redneck white man. Okay? A redneck white man. And we didn't believe her. But let me tell you, he came to visit, and he was a redneck. Ooh, was he a redneck. Crew cut, okay, cowboy boots, and chaw in the mouth. He was chewing tobacco and spitting in his Coca-Cola can. He was a real redneck. It was so funny. Anyway, when the baby was born by C-section, because she was early, when the baby was born by C-section, you would never see such a proud father. I mean, he was standing there, his chest was all puffed out, this was his baby. It was just the neatest thing. But anyway, 9 kids. So you want to find out the obstetrics history. Another reason you want to do it also is why? Because you know that multiples, especially grand multiples, are more prone to precip deliveries, right? Precipitous deliveries. And they're more prone to also bleeding, hemorrhaging after birth. So you got to find out all these things. What else are you going to do for a woman? Well, you can do the external exam. You can do the external exam yourself. You can look at the labia, you can look at the vulva, you can look at the mons pubis and see if the Bartholin's gland is right in the perineal area, and the Skene's gland's a little bit above. They're close to the urethra. So you want to check and see that there are no lumps or bumps, because the Skene's and Bartholin's can become infected and inflamed, and that's very, very painful. I had a 16-year-old come in, and she'd had a cyst in her Bartholin's gland. And this child had to walk in with, like bow leg, because it was so painful. And then when we went to put in a lithotomy position, we had to lance it. We had to lance it and just pull. There was so much pus in there. So you really want to check and make sure that what you can do the outside, okay? The inside is done by the doctor. Now, the inside, they're going to use a speculum. Be kind to your patients. The doctor may not think about it, but you please be kind. Take that speculum before he comes in. Run it under some warm water and warm it up. Because all you women know, right, the last time you had a pelvic and you put your legs up and assumed that position, and the doctor came at you and put that cold metal speculum inside of you, you hit the ceiling, right? Oh, what a rush. So be kind. Warm it. Warm it. Now, the cervix, when he puts the speculum in, okay, the cervix that you're looking at, because he wants to look at the cervix, should be pink. If it's engorged or bluish, then it's something called Chadwick's sign, and that's a possibility that she might be pregnant. It's not a definitive test, definitive diagnosis, but it's a possible, okay? The internal exam is also how you get your cultures for your GC and chlamydia and trichomonas. It is also how you get your culture for your pap smear. You also want to ask, do you conduct your monthly self-breast exams? Some people don't. Now remember, she's got to do two things, right? One is that she's got to palpate around the breast, and the other one, she has to stand or sit, put her arms on her hips. If she's sitting, sit upright, no bending forward. Sit upright and take a look at herself in the mirror to make sure that her breast contours are nice and even. There's no dimpling, there's no discharge, there's no redness, there's no orange peel, anything, right? So you're looking at the normal. So you need to ask her, are you conducting self-breast exams? And if she isn't, then you need to teach her, because some people don't know. And some people are too ashamed. And you can tell them, no, this is the one legitimate time that you can't touch yourself. Okay, when you're assessing a couple for their reproductive history, you don't just look at the woman, you have to look at the man also. So from the guy, you've also got to get his complete health history and his complete medical history. Okay, so complete health history. And you know what you want to do? Do this separately. Don't put them in the same room, because he may not want to tell her about all the girlfriends that he had in the past, and vice versa, because he might end up going home and having a big old fight and be your fault. Okay, so do it separately. And of course, tell them both that it's confidential. Okay? So complete health and medical history. Does he have hypertension? Does he drink? Okay, does he smoke? All right, does he have anything that ran in his family? I mean, is there any diabetes? Is he diabetic? You also want to know his complete sexual history and his current sexual activity. Again, make sure that you are separate, because he may have a girlfriend on the side and not want to tell you, So you want to know his complete sexual activity as well. Now, for the guy, you're going to have to do an external exam as well. So what you want to do, external and actually internal as well. So what you want to do is you want to have him void first, and you want to have him stand during the exam. Now, what you've got to do is inspect his genitalia for sexual maturity. And what does that mean? It doesn't mean size. It just means, It doesn't mean size. It just means that it's mature, that it had the penis has a head, that it has a shaft, that he's got testicles, okay, that he's got pubic hair, all right, that sort of thing, sexual maturity. Inspect this penis for something called phimosis, especially on people who are not circumcised. I had a patient come in, and he had not been circumcised, and his foreskin was wrapped all the way around the head of his penis. Okay, and it was severe, severe pain. He had never retracted his penis. His penis had never retracted the foreskin. Well, we had to retract the foreskin. It took us 45 minutes to retract the foreskin. And the smegma that was underneath that foreskin, oh my, knocked you for a loop. It was terrible. Okay, and he couldn't understand why he was having all these infections. But we explained it to him. Not being circumcised